and I'm joined this afternoon by Professor Barry Doyle, who is Professor of Health History at Huddersfield University. Good afternoon to you, Barry.
Hi.
And to Dr. Mike Gent, who is the Deputy Director for Health Protection in the Public Health England's Yorkshire and Humber Centre, based in Leeds. Long title, but we got there, Mike. Hello.
Thanks. Hi.
Welcome to the show, both of you. Barry, if I can start with you. I'm ashamed in a sense that I was so ignorant on the matters of Spanish flu until I mentioned earlier on a conversation with Look North health correspondent Jamie Coulson on the issue. This was extraordinary. The numbers, when you look at them, were just utterly extraordinary, weren't they?
It is. I mean, the current estimates of between 50 and 100 million worldwide make it certainly more effective than, or more virulent than the Black Death and anything that's happened since. Many more people died than died in the war, and probably just because of it happened at the end of the war, it was the historical memory was lost, and the fact that the kind of end of the Great War and the slaughter there overtook the Spanish flu, and we didn't really remember it until, broadly speaking, the second half of the 20th century when it started to be talked about again.
Yeah, why was it so virulent? Why was it so contagious? What was it about that particular illness?
I mean, I'm not the epidemiologist, so I don't know about the kind of what the virus was like, and indeed it's still very much up for grabs whether or not it was an avian flu or sort of swine flu, or it kind of mutated in some way. Historians, including John Oxford, who appeared in the piece there, have looked at some his material from the 1918 epidemic, some DNA, and have tried to reconstruct it, but they're still not 100% sure where it came from or why it was so effective. In terms of kind of social elements of it, again, they're mentioned in the piece there, it was a lot to do with the fact that large numbers of people were crammed together in various different places. In the British context, the government actually refused to close schools, to make a requirement to close schools. They kept the cinemas open as long as you opened the doors every 3 hours to let the stale air out. So people were allowed to kind of continue to congregate on a fairly extensive basis. And then on top of that, right slap bang in the middle, you have the armistice celebrations.
And people tend to think of flu and various forms of flu. They think it affects mainly the very young and the very old. The Spanish flu was a bit different, wasn't it?
It was very much so. At least a third of the mortality in the case of places, big cities like Leeds and Sheffield, were people in the age range 50 to 35. Probably more women than men. Certainly in the case of Leeds, quite a lot more women than men. And these are young, healthy adults who don't normally get badly affected by flu. And indeed, the elderly seem to have been not particularly worse affected than would normally be the case in a kind of standard influenza episode. So lots and lots of young people, probably because they're going to work. So in the case of Leeds, women work as well as men. They work in the textile industry, and particularly in the clothing industry, so they're kind of important munitions centre. And so everyone's still going to work. They think they can shake it off. So after a couple of days, they may have spent a day in bed, but then they get up, they go back to work. And on day 4, they are affected by pneumonia and often die within 12 hours of that. And similarly with women, they're also often looking after their families. So if their kids have got it, or their husband or their elders have got it, they're looking after them, and they're kind of in continuous contact with the disease, and then often they die at the end of nursing the rest of their family.
And Dr. Mike Gent, is sort of part of your job, I suppose, to look at, and people that you work with, to look at how illnesses and diseases spread amongst populations, how they spread across continents and that sort of thing. I mean, I don't think we've seen anything quite like this since Spanish flu, have we?
We've not seen anything quite like Spanish flu. We have had pandemics since then. So I think we had 1958, 1967 and 2009, which I think many people will remember, which was the so-called swine flu.
Yeah.
Now, that was very mild.
Define a pandemic for us, just for those who might not know.
So if we go back to flu, I mean, the basics is that there are a number of different types of flu. There's one particular type of flu called flu A, and that changes every year. So it slightly changes, the virus slightly changes, which is why we change the flu vaccine every year, to make sure that it matches the virus which is circulating. pandemic, when you get a sudden change in that virus, and the majority of the population is not immune to that. Because of the viruses are circulating on a regular basis every year, we build up a bit of an immunity to them. But when it suddenly changes, it becomes a very different virus, then we don't have an immunity to it. And that's when it will spread very quickly through our population.
Yeah.
So if we think Australia at the moment, it's sort of our summer, back end of it, it's their winter. So flu circulating down there, it then comes around the globe and comes to us in our winter, their summer. And we change the virus change the vaccine according to which virus is circulating on either side of the world.
Okay, and you can do that by taking a sample, I guess, of what's circulating over there and bringing it here.
Yeah, it's not an exact science, but you can hopefully predict, and that's why we change the vaccine every year.
Yeah.
So in this particular context, 1918, it was a H1N1 virus, a particular type of virus, which nobody had really been exposed to before. And I think Barry's point about the young people, one of the theories is that it affected the younger people because they had stronger immune systems, and effectively it was their immune reaction to the virus which brought about their demise. Whereas older people, and we saw that again in swine flu as well, some of the older people were perhaps better equipped to cope with it, or more immune because they've been exposed to a lot of flu viruses over their lifetime.
I see. So in fact, if you had a very strong immune system, it wasn't necessarily an advantage.
Might not have been, yeah.
Right,
I don't think that's a proved theory, but it's one of the theories about why it affected that younger population.
Yes, yeah. How quickly did it spread in terms of getting from one person to the next, or from getting from one town to the next, or from one country to the next?
The historians are kind of still working on the early stages of it. It starts off, possibly there are some suggestions it's being seen in 1917, maybe even actually in Spain. It's certainly in Kansas in the early part of 1918. It arrives in Britain in June 1918. It has a small, kind of fairly normal, if you like, normal influenza period in midsummer, and then it dies out. And then, once it picks up again and comes back, it's through the ports. It's generally regarded as comes through movement of people, soldiers, general movement of populations. It spreads very, very quickly. And if you look at the mortality figures, they sort of rise within 3 weeks. They're reaching almost peak levels, and they stay at peak levels for about a month throughout November 1918 in the British and French European context. That's the worst possible time.
And it was an illness, from what I've read about it, that you would get, and we hear stories about the Black Death like this, you would understand that you had the illness, you would very quickly appreciate that you had this particular illness, and then the fear that this might very well take your life, because it took so many. I mean, it was a terrifying time for almost everybody, which must have been very unusual. Normally somebody feels protected from it, removed from it, but everybody must have been fearful at this time.
Certainly, and it, coming at the end of 4 years of war, and which had affected for the first time, an entire population. In the case of again the countries of Western Europe, you've been in a situation where if you're, sort of adult woman, maybe your family members have been fighting, maybe they've died, entire villages or entire kind of working class areas through PALS battalions. These have all been killed. So people are already kind of in this heightened state of fear about death, about very fatalistic about what's happened during the war, and then this disease kind of comes in from nowhere, and you do see sort of kind of fatalistic or spiritualistic or kind of, if you like, not very modern responses. So, for example, in the case of Leeds, they offer to house the bodies in the public mortuary, and the local people say, no, we don't want to send up our bodies there because it's associated with the state, it's associated with the infectious diseases hospital, it's associated with all the things they don't like about kind of public medicine. So they kind of resist that and say they want to stay in religious types of places. So the local churches make church halls available, for example, to store bodies there.